Hello everyone and welcome to another CB Clips. In this week's CB Clips, we have a girl who comes in with abdominal pain. Ultrasound suggests ovarian torsion. You go to the operating room for a laparoscopy. You find no torsion, which is not surprising because ultrasound is not very accurate for that diagnosis, but you find an enlarged ovary with no disease outside the ovary and no obvious mass. What should you do? Well, this case really emphasizes an important clinical principle, and that is the principle of ovarian preservation in the majority of girls who present with any ovarian pathology. Why? Well, first, the incidence of malignancy in ovarian lesions in girls in general is somewhere between 2 and 10%. So the overwhelming majority will have benign disease, either functional or neoplastic. Second, if you don't have disease outside the ovary and you have normal markers, you can be quite sure that that's highly unlikely to be malignant. Therefore, you should follow an ovarian preserving approach. In this patient, we stopped the laparoscopy, we followed her with an ultrasound in a few weeks, and when the ultrasound still showed an enlarged ovary, we went to an MRI, which is an excellent modality as we have recently shown if you have access to it. It showed a nice teratoma within the ovary. We were able to take the patient to the operating room, do an ovarian preserving approach, what I call a rosebud approach, opening the ovarian capsule and shelling out the tumor. And interestingly, 3 months later, this patient actually had a cyst on the other side. An MRI at the time showed a clear functional cyst, but excellent symmetry of the ovaries with well-preserved ovarian tissues. So again, to summarize, how do we preserve the ovary? Well, we follow an observational approach if there's any doubt that there is mass in the ovary. And then when we actually approach the ovary, we perform an ovarian sparing resection. Thank you, and until another CB Clips.